Well, welcome to Ask an MS Expert Veterans Program. My name is Emily Riley, and I am the moderator for this wonderful program. I'm a proud Air Force wife, dog mom, certified personal trainer who creates adaptive fitness classes for the MS community, and I've been living with MS for over 17 years. I'm currently located at Scott Air Force Base. Thank you for joining us. The National MS Society is committed to offering a place to connect and ask questions to MS experts on topics impacting veterans affected by MS. MS navigators are online throughout the program, answering questions and providing resources. So please post any questions or comments that you may have in the comments box on Facebook, YouTube, or Twitch. As we approach Veterans Day, I want to thank all veterans for your service. Thank you for your bravery, putting your lives on the line, sacrificing time with your family, and risking your own well-being to keep us safe. You are very much honored and appreciated for all you do. I would like to acknowledge and thank today's national sponsor, Lockheed Martin. Support from MS community partners helps the National MS Society reach our goal of providing up-to-date information and support through programs like Ask an MS Expert Veterans Program. So fatigue is one of the most common symptoms of MS. Though the cause is currently unknown, several different kinds of fatigue can occur. Some may experience fatigue that isn't related to MS, which can be confusing and frustrating. People with MS say family, friends, or employers sometimes misinterpret their fatigue. They think it's depression or not trying hard enough, which can be harmful to the person living with MS. Joining me today is Dr. Anza Memon. Dr. Memon will talk about the types of fatigue, management options, and VA resources. Dr. Memon is the director of the Multiple Sclerosis Center and the Neurophysiology Laboratory at the John D. Dingell VA Medical Center in Detroit, Michigan. She is also an Associate Professor of Neurology at Wayne State University School of Medicine. She specializes in the treatment of MS, and her main areas of research interests are MS cognition and fatigue, among others. I'd like to ask Dr. Memon to join me on camera. Thank you so much for being here today.
Thank you so much, Emily, for having me here today.
So about 80% of people with MS experience fatigue, including myself. And it can interfere with a person's ability to function both at home and at work, and there's no known cause. So let's start by defining what we know. What is fatigue, and what are the different types that people may experience?
So fatigue is a complex symptom that covers a wide range of experiences, from physical tiredness to mental exhaustion. Now, in most general sense, the fatigue refers to a state of decreased energy, decreased motivation, and a feeling of needing a rest. So it varies from physical to mental exhaustion, and that can be chronic, especially in conditions like multiple sclerosis, chronic fatigue syndrome, fibromyalgia. And additionally, there is a secondary fatigue, which arises as a result of other underlying medical issues.
So how is MS fatigue, also known as lassitude, different from other kinds of fatigue?
So MS-related fatigue is unique and different from other types of fatigue in a number of ways. It's not due to sleep deprivation, depression, overexertion, or any other mood disorders. It often happens daily. It strokes early in the morning, even after a restful night's sleep. It usually interferes as the day goes on or day progresses, and has some associations with the climate changes. Hot and humid conditions can make it even worse. It can come on suddenly with little warning, and it's more likely to interfere with the daily activities. Now, I typically divide fatigue into two types. The one type is just the general feeling of tiredness, and the second type is more of we call it a muscular fatigue, which occurs with sustained physical activities, such as performing motor tasks like walking or running.
Yeah. And that can be so frustrating if it like comes and goes, or you don't really expect it. And you're like, I slept well, but I'm still experiencing fatigue. And we heard from Keith, who's been a veteran of 30 years and was diagnosed with MS about 15 years ago. And he's always been healthy and active, but feels more exhausted from daily activities. And he's frustrated because he can't seem to bounce back like the way he used to. So this sounds like an experience that a lot of people living with MS have. So how would you begin assessing Keith's fatigue, and are there specific tests that you would use?
This is a great question, Emily. To properly diagnose fatigue related to multiple sclerosis, the first step is to rule out non-MS related causes. We can't just assume that everything is related to multiple sclerosis. So remember that fatigue can be a sign of various other health issues like anemia, infections, thyroid problems, sleep issues, or even nutritional deficiencies. So healthcare providers often start by ordering tests to eliminate these other possibilities. Moreover, if you have MS, you might experience some neurological issues connected to disease like spasticity or nerve pain associated with multiple sclerosis. And that could also mess up your sleep and worsen your MS fatigue. Now, generally in my practice, I make it to a point to have in-depth conversations with my patients. So the goal is to gather as much information as I can, which helps me decide on the most appropriate test to diagnose the cause of their fatigue.
Okay. So as a follow-up, why is it important to consider someone's lifestyle factors when assessing fatigue?
I think considering lifestyle factors offer a more holistic approach to diagnosing and managing fatigue. It allows healthcare providers to develop a comprehensive treatment plan that goes beyond addressing just the medical or neurological aspect of fatigue. Some of these factors include sleep hygiene, nutritional status, exercise or physical activity, as well as mental and emotional health. Oftentimes, asking patients some related questions about their work-life balance or maybe substance abuse like smoking, alcohol, or environmental factors, because there's a long list of factors that can be a part of a patient's lifestyle or daily living.
Yeah. So it sounds like this may require kind of a comprehensive approach. So what healthcare professionals should Keith work with for managing fatigue? And are there resources that he could access through the VA?
It's a great question. I think the first of all, what you should be doing, you should be reaching out to your primary care physician or a neurologist, and they can help you rule out other unrelated causes or unrelated to multiple sclerosis, I meant to say, and other neurological conditions. So Keith or anyone listening, you might consider working with your dream team to tackle fatigue. And what I call as a dream team is more of a collaborative effort among group of specialists. For example, a dietitian, who can help you revamp your diet for better energy level, a physical therapist who can create a custom exercise plan that boosts your energy without worsening your fatigue. An occupational therapist can offer strategies to tweak your work and home settings, reducing factors contributing to your fatigue. And let's not forget about your mental well-being. So a psychologist can offer invaluable support if you're undergoing a stressful situation or a mental health challenge, which is contributing to your fatigue. The great news, if you are a veteran, the VA system offers a one-stop shop for all these valuable resources. So the simplest route to tap into these services is to consult your neurologist or your primary care physician, who can then refer you to the specialist who's best suited for your care.
Great. I love the concept of a dream team. And then the fact that, the VA is like that one-stop shop where you can really get all those people collaborating so that someone can, combat fatigue. So that's really helpful. So let's talk a little bit more about managing and reducing MS fatigue, so that people can maintain a healthy and active lifestyle. So what are some strategies to manage fatigue?
So there are many strategies to manage fatigue, including lifestyle modifications, mental health interventions, and rehabilitative therapies. Lifestyle modifications can be small or can be big steps towards something different. For example, I always, tell my patients that you need to journal your fatigue. It's a very simple way, but it's something that you may have to incorporate into your daily life. This can help you understand the patterns and then develop energy conserving techniques. For example, if you're overfilling your day, you may have to get rid of a few things from your day or remove a few things from your day and take breaks if you need them. So this is going to help you recharge or conserve your energy. Pay special attention to your diet. We all know that the healthy diet is very important for your mental health and for your physical health. So eat healthy, have more fibers, more protein, less carbohydrates, and avoid eating packaged foods. Exercise is utmost important. Now, more and more studies are showing that aerobic exercises or cardiovascular exercises that increase your heart rate are very good for MS-related fatigue, even for chronic fatigue syndromes. And these exercises can improve balance, endurance, and well-being. And if you're unable to do continuous exercises, then you could incorporate more of an intermittent exercise regimen, such as stationary bike, yoga, Pilates, stretching, whatever you like. Pay attention to your sleep hygiene. If you suffer from insomnia or if you have sleep apnea, you need to consult the sleep medicine physicians or providers, and you could always get a referral from your primary care physician or a neurologist. And if you have been diagnosed with sleep apnea, then it's very important for you to use your CPAP machine every day.
Yeah. Awesome. I love that you encourage exercise. As a fitness professional myself, that makes me very happy to hear that. So I know that there's like a couple different ways to manage fatigue. Let's first talk about maybe pharmacological. Are there any medications commonly used to help with fatigue?
Emily, that's a great question. So just to let the audience know that there are no FDA-approved medications to treat MS-related fatigue. So most of the medications that we have been using are actually off-label. And growing literature supports that these medications have low to moderate effects on MS-related fatigue. Some of the most common medications are amantadine. This is one of the most traditional medication that we have been using for a very long time. It was approved a few decades ago for Parkinson's disease. It's primarily an antiviral drug. Then we have medications that help improve daytime sleepiness, such as armodafinil and modafinil. And again, these medications are approved for sleep issues like obstructive sleep apnea, shift work disorders, and narcolepsy. Then you have the classic CNS stimulants, central nervous system stimulants, such as methylphenidate, amphetamine, and dextroamphetamine. And these have been used broadly for treatment of attention deficit disorders and attention deficit hyperactivity disorder that we call it ADD and ADHD. Now, there are other medications that we could use for fatigue, such as high doses of aspirin. So some literature shows that higher doses of aspirin, and when we talk about the higher doses, it means between 500 and 650 milligram dose. It reduced the time of exhaustion during exercise. Now, these are small studies with a very small sample size, so we don't necessarily change our practice recommendations based on small studies. So I would hesitate to put someone on higher doses of aspirin, particularly in an individual who already has some stomach problems, because it can make it worse. Now, we also use certain antidepressants, and we know that the mood issues are very common in MS, and we might be talking about it in a little bit. But, we commonly use some antidepressants, which could be very effective for both mood as well as for fatigue, such as, I would like to take a few names here, such as bupropion, citalopram, duloxetine, fluoxetine, and venlafaxine. These are very commonly prescribed.
Okay. Awesome. So someone's interested in maybe using one of those to consult their doctor before making any changes.
Absolutely.
Well, great. So now let's dive into like the non-pharmacological treatments that have been successful for people in managing their fatigue. What are some of those?
Well, this is an excellent question. I think a lot of our patients even don't know that there are non-pharmacological options available for them. So the two main options that we have available are mostly therapies and interventions. So we have mental health interventions and we have rehabilitative therapies. The two most common mental interventions that we could use to help fatigue actually are cognitive behavioral therapy and mindfulness-based cognitive therapy. So these two therapies have been widely used for treatment of mood disorders such as anxiety and depression, are equally effective for treatment of fatigue, any fatigue actually, chronic fatigue, MS-related, non-MS related, or related to any other neurological condition. Now, MBCT, which is also known as a mindfulness-based cognitive therapy, primarily incorporates the principle of mindfulness. And as we all know, that mindfulness is a state where one feels fully present now and does not interact to their thoughts and their emotions. So combining these techniques can be very effective. in managing MS-related fatigue. Physical therapy plays an important role in fatigue management, and one of the reasons I refer my patients for physical therapy are basically to learn exercise techniques from the physical therapist and then apply those techniques into your daily lives to improve fatigue and endurance. Occupational therapy is equally effective and not only improving fine motor skills, but it also teaches coping skills for self-care and self-management.
Love it. So you mentioned a little bit about mindfulness, and I have a question from Bernie. She says that her doctor told her to try relaxation techniques, and her fatigue already makes her feel tired. So how can relaxation techniques be helpful? Is this what you would consider mindfulness?
Well, Bernie's question is an excellent question. One of the question that many people wonder about. So it's not just about feeling tired, it's about the quality of your rest. So even if you are fatigued, you might not be getting the kind of rest that restores your energy levels. So relaxation techniques can help you achieve that. For example, how? Because, I have had patients ask the same question and they said, how? So the relaxation techniques can lower your stress hormones like cortisol, helping you feel more rested. And these techniques can help calm your mind and improve your sleep patterns. And it enhances the mental clarity and improves attention, which is pretty obvious. If you get enough sleep, then it's, going to improve your next day, and it's going to improve your fatigue level. In some cases, we see that fatigue is not just related to sleep issues, particularly in conditions like chronic pain syndromes and MS-related fatigue. There are patients who suffer from nerve pain or chronic pain from their disease, and the relaxation techniques can also positively affect pain perception, thus indirectly helping with fatigue.
Oh, great. So can you share a little bit more about maybe some of the programs that the VA has that might be beneficial to Bernie or anyone else who's experiencing this to develop healthy habits?
Absolutely, Emily. VA offers several wellness programs, including nutrition program, weight management program, physical therapy, occupational therapy services to teach coping skills for self-care or self-management. And the best way to to get into these programs, to reach your provider, primary care physician, or neurologist, as I said earlier, and they can either involve a social worker or they can just put in consults for you so you can get into these programs and resources.
Great. So this is one of the hard things about fatigue. So MS fatigue is an invisible symptom, which means that no one else can see it. And Patty lives with relapsing remitting MS. Her biggest limitation is fatigue. She finds it difficult to express her situation and fears being misunderstood or thought as being lazy or unhelpful. And Patty, I feel you. So how can Patty explain fatigue to the people in her life who don't have MS?
This is a great question. So because fatigue isn't outwardly visible, explaining it to others can be challenging. Here are some ways Patty and others can make her situation more relatable to those without multiple sclerosis. The three take-home messages. Number one, be honest and specific. So instead of just saying she's tired, Patty can specify that her fatigue is a debilitating symptom of MS that affects her both physically and mentally. And the more specific she can be, the less room there is for misunderstanding. The second point is involving your healthcare providers or professionals from the get-go can be very, very helpful. So if Patty is comfortable doing so, having her neurologist or maybe another healthcare provider, her primary care physician, explain the nature of MS fatigue can add credibility to her explanation. And the third, which is the most useful resource that I think a lot of our patients can utilize, and unfortunately which we don't, because a lot of patients don't know about it. You could share pamphlets, videos, articles, which are basically designed to educate people around you, your family members, your professional family members at work, about the realities of living with MS and sharing these resources provide a more comprehensive understanding. And National MS Society have some really, really great resources. You can call the National MS Society number, and they'll connect you with the right person and provide you the resources.
Love that. So be specific and honest, get your healthcare provider team engaged, and then share the resources. Those are really great tips. So what are some other resources that are available through the VA that could help support Patty with maybe some of these difficult conversations that she really hasn't been able to have yet and might be nervous to have those conversations?
Yes, so the Department of Veteran Affairs offers a range of mental health resources and services to assist veterans and their families. Although these specific resources can vary by location, but some generally available options like support groups and proxy services exist. Just to clarify our audience that proxy services are not standard. So some VA facilities have, advocates or social workers or proxy services that can help veterans communicate their needs or navigate complex medical situations. So in these situations, I have been very successful actually involving our social workers to help provide resources to our veterans in these situations.
Great. All right. So you've talked a little bit about mental health and the impact that MS fatigue can have on it. And so Charlie told us that he experienced anxiety and depression after being diagnosed with MS. This interfered with his daily life more than his physical symptoms. And he feels like these mood changes have also caused more fatigue. So how do emotional changes like anxiety and depression impact fatigue?
Thank you for asking this great question, Emily. Emotional changes like anxiety and depression are common in MS patients and can significantly impact fatigue levels. The connection between emotional well-being and fatigue is often a two-way street. So emotional issues can worsen fatigue, and fatigue can exacerbate emotional disturbances. The anxiety and depression can also lead to sleep disturbances, increase muscle tension, altered, brain chemicals, which are also known as neurotransmitters in the brain, which can influence the perception of fatigue. So overall, it's like a vicious circle, and everything is connected. This extra stress can then trigger inflammatory responses in the body, further contributing to fatigue, especially in conditions like MS, where immune system is already compromised.
Mm-hmm. Okay, so Charlie mentioned that he takes a prescription to manage his mood changes. That I know earlier you had kind of mentioned some pharmacological options with some antidepressants and stuff. So do pharmacological treatments impact or increase fatigue, or can they help?
That's a great question, Emily. I think the influence of pharmacological treatments on fatigue can vary widely depending on the specific medications and the individual's response. Antidepressants and anxiety medications can sometimes lead to increased fatigue as a side effect, especially when you first start the treatment. Often, your body requires an adjustment period, and some side effects like fatigue may diminish over time. It is equally important to manage mood disorders effectively, as this can improve your overall well-being, both your physical well-being and your mental well-being, potentially offsetting any medication-induced fatigue over the long term. I would suggest keeping track of any changes in fatigue levels and reporting them to your healthcare providers for appropriate adjustments to your treatment plan.
It's a really good tip. So what VA support can Charlie expect to co-manage his mood changes and fatigue? And these may be some of the same resources that we've mentioned before, but I think it's helpful to mention.
Absolutely. So, as I mentioned earlier, we have mental health resources that are, readily available to our veterans. We have a social worker, and they can connect you with the right resources to see a specialist that you might benefit seeing from. If you suffer from mental health concerns where you would like to speak with someone, maybe a psychologist, but not a psychiatrist. We have a social worker in our program, and they do a fantastic job in connecting you with the right resources.
Great. All right, so kind of shifting gears a little bit, we'll talk a little bit about like disease-modifying therapies. So Jose asked if his MS disease-modifying therapy could be causing his fatigue. Is it possible for MS disease-modifying therapies or other medications for like MS symptoms to cause fatigue?
Well, this is a very tricky question. As we already discussed that fatigue is the most common symptom of MS. I think, Emily, in your talk in the beginning, you mentioned about 80% of MS patients suffer from fatigue. However, some disease-modifying therapies and other medications used to manage MS symptoms could contribute to fatigue. So the most common and the most traditional and medications that could cause flu-like symptoms, which are interferon-based therapies, they may include fatigue because we know that one of the symptom of flu is a fatigue. Now, we haven't been using these interferon-based therapies a lot lately. I should say lately because in the past we have used them broadly because we didn't have any other options available, but now we have numerous disease-modifying therapies available to use for treatment of multiple sclerosis. Infusion-based therapies such as ocrelizumab, rituximab, naluzumab, and primarily these three main options that we've been using widely, can sometimes result in infusion fatigue. And this can happen both during infusion or after the infusion, but it's a transient fatigue, so keep in mind. Almost all other FDA-approved disease-modifying therapies are very well tolerated, and fatigue is not commonly reported with these medications. Certain medications that we use for treatment of MS symptoms can potentially worsen fatigue. We use muscle relaxants for spasticity, such as baclofen and tizanidine. These medications can sometimes induce a feeling of drowsiness and sedation that may exacerbate fatigue. Similarly, nerve pain pills or pain medications, either opioids or non-opioid options, sometimes they can exacerbate fatigue. And the most commonly or broadly used nerve pain pills or neuropathic pain medications are gabapentin and pregabalin and tricyclic antidepressants like nortriptyline and amitriptyline. The same medications can be used for mood disorders, and they can also exacerbate fatigue. So being aware of these side effects is crucial, especially when managing complex conditions like MS.
Yeah. Now, I know you had mentioned something to the effect that sometimes like the environment and weather can affect MS fatigue. And so Harper is a retired veteran who was recently diagnosed with MS, and she lives in the Southeast, and every summer she experiences terrible fatigue relating to hot and humid weather. Occasionally the heat's so bad that she can't even go outside. And so Harper's wondering how heat impacts fatigue.
Great question. And again, thank you for asking this question. So many MS patients, including Harper, frequently find that their symptoms, especially fatigue, deteriorate in hot conditions. Mm-hmm. This is actually a well-documented effect. It's called Uthoff phenomenon, and it's a condition characterized by temporary worsening in your neurological condition, which means you already have existing neurological symptom, but there's a temporary worsening in it due to increased core body temperature. And the phenomena is named after a German ophthalmologist, actually a neuro-ophthalmologist, Dr. Wilhelm Uthoff, who initially noticed that this pattern in people suffering from optic neuritis. And he observed that their visual symptoms worsened when their core body temperature, increased. So in MS, we know that it's a chronic demyelinating disease. So these demyelinating axons are less efficient at conducting electrical impulses, and heat can exacerbate this inefficiency, leading to increased fatigue and other symptoms.
Got it. So what kind of solutions to help keep her cool would you suggest?
Yeah, so here are some solutions, and the goal of these ideas is to maintain a lower core body temperature. Wearing a cooling vest can help maintain a lower core body temperature. Make sure to stay in air-conditioned spaces whenever possible during hot months like summer. Drink cold fluids, keep yourself hydrated. Use cooling towels around your neck when you go outside in a hot, humid day. Avoid direct sunlight. So when you need to go outside, try to do maybe during the cooler part of the day and stay in the shade. Try to stay in the shade. I know sometimes it's really difficult if you're having a beach vacation. You can carry actually portable fans, and that can provide immediate relief. If you're getting really hot and you know that you start experiencing fatigue and other symptoms, you can just have your own fan. Try to avoid running or strenuous activities during the hottest parts of the day, and take frequent breaks if needed.
Love that. Yeah, I always find myself right in front of a fan when I'm like working out, just to kind of, maintain that body temperature to keep it nice and cool. Well, those were really helpful tips, and we're kind of to the end. And so you've shared a lot of really great information and tips. So I want to know, what are your top 3 takeaways that our audience can begin to act on right away?
Thank you, Emily, for having me here today to discuss this very important topic. I'm humbled and honored. Fatigue is not just a side issue for people with MS. It's often a primary debilitating symptom that can take both a physical and mental toll. The roots of MS-related fatigue are multifaceted and involving factors like acute and chronic inflammation, disrupted sleep, mood disorders, decreased physical activity, and emotional stress. So it's fundamental to acknowledge this complexity to develop effective treatment plans. At the VA, we believe in a collaborative approach to managing multiple sclerosis fatigue, involving a team of healthcare providers and experts, from physicians to therapists. So please don't hold back when talking to your healthcare team about this significant challenge.
Love it. Well, great. Well, thank you so much for joining us today. I really appreciate your time and your tips. And thank you for everyone who has submitted comments and questions in the chat box. The Veterans Affairs Multiple Sclerosis Centers of Excellence are dedicated to furthering the understanding of multiple sclerosis, its impact on veterans, and effective treatments to help manage MS. To connect with the MS Centers of Excellence, call 1-844-MY-VA-311 or 1-844-698-2311. Visit www.va.gov/MS or email mscentersofexcellence@va.gov. These are all on the screen for you. If you or a veteran you know is in crisis, please call the Veterans Crisis Line, dial 988, then select 1, or you can text 838-255. I'd like to remind everyone that you can connect with an MS navigator via phone, email, and through the Society's website via chat. For information and resources on MS, visit the Society's website. You'll find research updates and news, self-help groups just for veterans and active duty military, and more ways to get involved and upcoming events near you. You can connect with the National MS Society and others affected by MS via Facebook, Instagram, Twitch, Twitter, YouTube, and LinkedIn. I encourage you to like, subscribe, and/or get on the Society's mailing list to continue to receive up-to-date information on MS and updates on upcoming programs. I want to thank Dr. Memon for sharing her knowledge and for everyone's engagement in today's program. The recording will be made available on the Society's website at www.nationalmssociety.org/MS expert. I invite you to join us in March for our next Ask an MS Expert Veterans program. Lastly, it's important to get your feedback on today's program. You'll see a link for the survey in the comments section or in the program description on YouTube, Facebook, and Twitch. Completing the survey makes a difference, and it only takes 1 minute to complete. The information you provide really helps continue to improve and shape future segments. Thank you so much for joining us, and we will see you soon.